You're listening to the Jefferson Exchange. Thanks for joining us. The JX starts today with the debrief, where JPR reporters discuss the stories they've been covering this week, including new rules in a case about homelessness in Grants Pass, more lawsuits against Asante in Medford, and a proposed bill to end vote by mail in Oregon. We actually won't have that Grants Pass story. Jane Vaughn, one of our reporters, is out today, but I'm Maria Carter. I'm JPR's news director.
I'm Justin Higginbottom, public health and safety reporter.
And I'm Roman Battaglia, politics, environment, and energy reporter.
And Rowan, you brought us a story from the Oregon legislature about a bill proposed by a state senator here in our region that drew so much attention it overwhelmed the legislature's website. What could this bill be about?
Yeah, it was about the state's vote-by-mail system. This bill would essentially get rid of it entirely. It was introduced by State Senator David Brock-Smith, who represents Coos, Curry, and part of Douglas County. Basically, it'd be going back to in-person voting on Election Day. Some people could still vote it by mail, like if you're in the military, if you can't make it to the polling place, and it would also require people to show picture ID when voting. This is kind of interesting because Oregon is the oldest state to conduct elections entirely by mail. Vote by mail began for local elections back in 1981. Originally, the state saw it, and currently the state still sees it as a cost-saving measure because you don't need to hire staff and run all these polling places. Voters eventually approved Measure 60 back in 98 with nearly 70% voting yes, which made vote by mail the default here. And, vote by mail was clearly popular, and it's remained pretty popular since. It's been supported by all the secretaries of state in Oregon, including the Republican ones. And vote by mail has also boosted turnout in the state, making Oregon one of the highest turnout rates in the country. And a number of other states have followed suit. Washington, California, Nevada, Utah, Colorado, Hawaii, Vermont have all now do vote by
They
mail.
all want to be like Oregon.
Yes, basically.
Well, you've told us all the good things. Why does Senator Brock-Smith want to get rid of vote by mail?
Yeah, it basically comes down to concerns about election security. It's some of the similar claims we've been seeing nationwide about the attacks on vote by mail. State Representative Court Boyce said that a lot of people he talks to in his district don't trust the current voting system. Interestingly, Brock-Smith also brought up concerns about the USPS, which is something I've really only heard from Democrats lately, concerns that the Postal Service is being disrupted nationally and locally here, and that the ballots as a result are being delayed. And we have seen examples of ballots locally here that have been delayed enough that they have not been counted. So, when the ballots go into the Postal Service, they're out of their control, is his argument. One important point that I haven't mentioned yet is that this bill would be a referral to the voters. If the legislature passed it, Oregonians would get to have a say on it in a future election. Here's David Brock-Smith.
The opportunity, again, within this piece of legislation is to let the voters of this state reaffirm on whether or not vote by mail is their choice.
So, in the past, vote by mail has been really, really popular in the state, even among Republicans. But if it were referred to voters again, I'm not really sure how things would turn out based on the national attacks on mail-in voting and, the way sentiments have kind of changed in recent years.
Well, what made this bill so controversial that it crashed the state legislature's website?
Yeah, a lot of people are really passionate about vote by mail in Oregon, it seems, not only because we're the first state to do it, but because they really like the system and they trust it. I've had positive experience about vote by mail too. I lived in another state where you do in-person voting, and it certainly is a lot more work to go to a polling place. So, you can see why people like the convenience of it. I read a lot of the comments. Brock-Smith at the time of the hearing this week said there were over 9,000 comments. It was even hard to even load the page looking at all this testimony. But people said they're really proud of the system. They like it because it's easier, but it also, gives more time to research candidates and make an informed decision because you can just sit there with the pamphlet in your ballot. There's also people who submitted letters of support of the bill, though. A lot of the ones were about preventing non-citizens from voting and, supporting the voter ID requirements. Some people, including Brock-Smith, had also noted recent issues with the state's voter rolls. Recently, we saw last year the state found that around 1,200 people hadn't provided proof of citizenship before registering, and that was through the DMV's motor voter laws that register people whenever you interact with the DMV. And it also found that 10 of those people had voted in past elections. But those registrations didn't impact, most of them clearly did not impact November's elections, and they have been fixed. But that clearly is an issue that's happened.
Sure. Now, Senator Brock-Smith, he's a Republican, and of course, both houses in Oregon are controlled by Democrats. How does this impact like the fate of this bill?
Yeah, it doesn't even necessarily seem likely to make it out of the committee that it's in right now. Democrats in the committee itself didn't see the merit in the bill, and even if it made out of the committee, which it hasn't yet, it's pretty unlikely that it would pass the Senate or the House or get signed by the governor. So, this is really an example of some efforts locally to try to change the election system based on what we've been seeing nationally and how different things are here in Oregon versus how they are somewhere else.
Sure. Well, thanks for that, Roman. Justin, you have an update on a massive drug diversion case against Asante Rogue Regional Medical Center in Medford. What's new here?
Yeah, so more lawsuits basically against Asante. And in this case, also the nurse who's accused of swapping patients' fentanyl with tap water. So that drug theft allegedly caused dozens of infections and is linked to over a dozen deaths, according to authorities. And alleged victims filed 3 new complaints in the last week, with more to come, according to the Medford law firm that's representing them. I interviewed them, attorneys with that law firm, this week. And those lawsuits are from people, or in one case, their surviving family members, their estate, who say they were patients at Asante and under the care of the former nurse Danny Marie Schofield during this alleged drug theft. And for some background, Schofield is accused of replacing patients' liquid fentanyl, like what you would have in an IV, with non-sterile tap water. And according to these and other lawsuits, that resulted in bacterial infections, sometimes death, also just a lot of pain and suffering for those that weren't getting pain medication when they were at the hospital. A number of these alleged victims were in ICU units going through some major medical problems, so they really needed pain medication. News broke about this back in January of 2024, actually right when I started working at JPR, and Schofield was arrested and charged with 44 counts of assault in June. That's 1 count for each alleged victim. And although authorities said that they gave the number around 16 people in that indictment have died, they didn't charge her with manslaughter or murder, just with assault in the second degree.
Well, these lawsuits are only the latest, kind of as you've told us. How much could Asante be on the hook for?
Yeah, I added that up. Asante could face over $477 million in damages to those alleged victims, which is a lot. But remember, we're talking about dozens of people who were potentially impacted here. And some of these lawsuits involve people actually not named in the criminal indictment. So that number of victims that authorities charged her with, the 44 counts, the victims could be more because these lawsuits bring up other names that weren't included in that indictment. And in the few lawsuits that were just filed in the last week, one of those people wasn't actually named in the indictment. Not all these lawsuits name Schofield. Some are just going after Asante for not doing enough to prevent this level of alleged drug theft. Drug diversion is a problem that happens at all hospitals, especially with fentanyl. But this level of drug diversion, like this scope of drug theft, people argue that they should have noticed this, and there should have been some protocols in place there.
Well, you mentioned authorities charged Schofield. Do we know when she's going to go on trial?
We do not. So the trial date hasn't been set yet, and you can imagine in a case this large, the process could take quite a while. She is scheduled for a pretrial hearing later this month, but that hearing's been delayed before. It keeps on getting moved up on my calendar because I plan to attend that. Her defense has also had judges replaced in this case, although I believe they can't do that again. You kind of have a limit for how many times you can get a judge replaced.
There are only so many judges to go around,
Yeah,
too.
exactly, especially here. And so right now she's out on a $4 million bail. But an important point is that a lot of these civil cases, so these lawsuits, like I just mentioned, are stayed by judges, which means they're basically just paused until after this criminal trial concludes. And the argument for staying these cases is that making Schofield testify, or deposing Schofield in this case, would violate her Fifth Amendment right against self-incrimination. So you can imagine if she took the stand under oath, that might impact her criminal trial. I spoke with lawyers for these recently filed complaints, though, and they said they're going to argue against a stay for their lawsuits. And their reasoning is that they're really trying to get more information about the policies and protocols, kind of the general environment at Asante. So Deposing staff at the hospital, for example, not even including Schofield, would provide a lot of important information in this case. And they don't want to wait potentially years for this criminal trial to conclude to get that information.
Well, thanks for that. Roman, you also covered a legal win for environmental groups in Southern Oregon related to logging. Tell us what happened.
Yeah, so a U.S. District Court judge in Medford reaffirmed this ruling that was made almost a year ago over the logging of old-growth forests in the area. Last year, Magistrate Judge Mark Clark found that the Bureau of Land Management was not following its own rules that are meant to protect the northern spotted owl habitat, which is a endangered species. This was part of the this integrated vegetation management plan the BLM had approved a few years ago. It was meant to speed up these kind of forest treatment projects that the agency does, like tree thinning or prescribed burning. In federal court, just so you understand where we are.
Spell
in
it
federal
out for
court,
us.
A magistrate judge is kind of like a lesser judge, kind of. So if a party objects to their ruling, it can then be sent to another judge to review the ruling, and that's what happened here. So Judge Ann Aiken then agreed with Judge Clark's recommendations, basically.
So why were the environmental groups suing over this project?
Yeah, these environmental groups basically said that the BLM was using this IVM plan as a cover for logging in old-growth habitat. They weren't opposed to some parts of this plan, like prescribed burns, but they obviously didn't like the commercial logging in these old-growth forests. And they also wanted the BLM to work more closely with the community rather than trying to fight them by doing more tree thinning projects and stuff around, communities that are at risk for wildfires.
So what happens next here?
Yeah, the BLM could appeal the ruling if they want to. I tried reaching out for them, but I didn't hear back from them. Otherwise, basically, the BLM and these environmental groups will have to come together and then figure out how the government can come into compliance with the judge's ruling. And then I guess if they don't agree, then the judge will have to make another ruling. I don't really know how far that goes, but one person I talked to, essentially that means they said that these old-growth forests in the Medford District BLM's region are pretty much covered because of this ruling, which is a big win for these environmental groups, clearly.
Okay, well, Justin, you've been on a kind of our court beat lately. You covered another lawsuit against a different hospital in our region. This one was filed against Providence St. Joseph in Eureka. Can you tell us a little bit about that?
Yeah, so this was filed by Anna Nusslock, and she's being represented by the National Women's Law Center. And what happened in her case is that she was pregnant with twins, and at only 15 weeks into her pregnancy, her water broke, and she started bleeding, and she was having severe pain. So she went to St. Joseph Hospital. They told her that her twins wouldn't make it, and that her life was at risk. That's what her complaint at least alleges. But they wouldn't give her an abortion because of their policy against doing that when they can detect a heartbeat in the fetuses, which they still could, even when they said the twins weren't going to survive. At that point, they couldn't provide an abortion. So she was forced. They directed her to kind of the nearest place that could do that, which is Mad River Clinic, a drive away. In the complaint, which I bring up in the story, they gave her a bucket and towels because she was bleeding at the point and she was at risk of hemorrhaging. When she did get to the clinic, she did start hemorrhaging. That clinic did perform the abortion, and Nusslock survived, but she's suing St. Joseph for this policy. Supposedly, she alleges that they broke state law by not performing emergency care when her life was at risk.
And you reported previously on a lawsuit against the hospital by the Attorney General of California. What's different about these two suits?
Yeah, the Attorney General sued the hospital back in October, saying, again, they broke state law. So this new suit seeks monetary damages for Nusslock. With the Attorney General's suit, the hospital at first said, okay, we're going to maybe change our policies. There's some sort of agreement. But since then, they've asked the judge to dismiss that lawsuit on First Amendment grounds, on religious freedom grounds, saying they're a Catholic hospital. This is against their religious, religious beliefs, and that they would still actually perform abortions if the woman's life or the person's life is very much at risk. But allegedly, just this case didn't get to that point.
Well, thank you so much for bringing that story to us. That's it for the debrief this week. Thank you for listening. You can reach the newsroom with comments on our coverage and suggestions for things we should cover in the future through our news tip line. That's on our website, ijpr.org. You can also give there to support us. And you can find this program and more at jeffexchange.org or subscribe on Apple, Spotify, or your favorite podcast platform.